If I'm on insulin, should I be starting the keto diet? If you want to start the keto diet and you are on insulin, whether you have type 1 diabetes or 2, whatever diabetes you have, as long as you're on insulin, you need close medical supervision, because keto diet does not have sufficient amount of carbohydrates in them, and you kind of need carbohydrates for your insulin, because that can lead to things like hypoglycemia, which is low blood sugar levels, and that can be very dangerous. You can actually increase the risk of having what we call diabetic ketoacidosis. That is life-threatening. You do not want to have DKA, which is diabetic ketoacidosis, or hypoglycemia when you are on insulin and on the keto diet. You would need to work with your clinical team, because your insulin requirements would need to be lowered, and you would need to be closely monitored so that you do not have any of these conditions that I've mentioned above. Can you do it? I'm not here to tell you whether you can or cannot do it, because you're an adult and you can make up your mind for yourself. But I'm just here to provide you with the advice that you need. Keto diets, are they bad or good? I'm not here to say that. I'm just here to say if you are on insulin, or even things like sulfonylureas or glycoside, glimepiride, please speak to the clinical team before you start, or if you've already started, tell them you've started so that we can adjust your dose and monitor you closely to avoid complications and, in worst cases possible, life-threatening situations. I hope this helps.